It's what many First Nations have been saying for years. They're not getting equitable care when they go to the emergency room. But now a new study provides data into systemic racism in Alberta hospitals.
I don't know what more is needed. I think that, there's all kinds of data now being presented.
With decades of experience in nursing, there's nothing surprising about the data for Leah Bill. But she's hopeful by acknowledging that on average, First Nations patients are triaged lower when presenting in hospital will help bring change.
We need to take a look at our own biases and see how they are impacting our work.
We heard from First Nations people all over the province that they don't want to go to emergency departments, that they expect discrimination. They may drive further during a medical emergency to avoid a nearer hospital where they've had a bad experience.
The University of Alberta study looked at overall triage scores, but also compared specific injuries.
Broken forearm or a big bone broken in your leg, you go to the emergency department as you would need to for a break like that. First Nations were less likely to receive the more acute triage scores for those long bone fractures.
I think that that's a real stark, eye-opening piece of data. No one who would have that kind of an obvious injury should be triaged less than another individual.
With this data giving an opportunity to address racism and bias in healthcare, but also for Bill, a reminder that the system is changing.
Not to be discouraged. I think that it's really important for them to know that there are good people that want to do a good job, and not to be discouraged by those that may be acting inappropriately or are being discriminatory, that they have a right to good health service.
And highlighting the importance for all Canadians to recognize the reality of systemic racism. In Edmonton, Carly Robinson, City News.